I've experienced this many times, as I'm sure you all have. It is a common frustration when a patient's NG or feeding tube is displaced. The tape doesn't hold, it gets pulled during transport, or a confused patient continues to remove the tube. As a matter of fact, studies show that about 40% of patients with a feeding tube will inadvertently pull them out. This costs you time, money, and ultimately delays the patient's care, leading to an increased hospital stay. Up until now, there has been no reliable, non-invasive securement method for holding an NG tube in place. And this is why the NG guard was invented. The NG guard is intended for securing and maintaining NG and feeding tubes. While preventing accidental pullout, the NG guard offers both safety and securement without sacrificing patient comfort. The NG guard has two main components, the bracket and the head strap. The bracket has a foam liner to maximize patient comfort, an NG lock that can slide from side to latch onto the nasogastric tube. The ratchet strap locks the nasogastric tube into place. It is important to note that you do not want to lock your nasogastric tube into place until after you have confirmed placement. To do so, follow your hospital protocol. Before I show you how to place the securement device, it's important to note that the NG guard was designed to fit nasogastric and feeding tube sizes 12 to 18 French on non-intubated adult patients. It also works on a 12 French Dobhoff tube. So take the NG guard out of the package. If you have difficulty deciding which side is up and which side is down, you can do so by looking at the logo on the back of the head strap, or by ensuring that the NG lock is facing upward. Make sure the skin is clean and dry before placing the device on the patient. Undo one side of the head strap. Place the device on the upper lip and slide the NG lock so that it is below the nasogastric tube. Wrap the strap around the patient's head and secure it so that one side is above and one side is below the patient's ear. Adjust the connecting head strap and ensure that there is enough space for 2 finger width between the patient's head and the head strap. Once in position, lift the hinge so that the nasogastric tube latches on to the NG lock, and tighten the ratchet strap. Take the free end of the strap and tuck it into the NG lock. The NG guard is single-use and latex-free. The benefits are it's non-invasive, it's more reliable than tape adhesive, and it can stay in place for up to 29 days or the life of each individual tube. This saves you time and provides better overall patient outcomes. Every package contains a quick reference guide. You can also download more resources on our website or call our technical services team.